Hello, everybody. This is Richard RJ Eskow for the Zero Hour, and this is your moment of random news. The United States Department of Justice announced this week that a doctor has admitted to providing medically unnecessary chemotherapy to patients in return for payment. A doctor in the Detroit area has been found guilty, in fact, has pleaded guilty to a number of counts of healthcare fraud and money laundering. He provided unnecessary chemotherapy to a number of patients in return for payments from Medicare that totaled $225 million. Now, the impact of this story is twofold. One, it tells us that there are very terrible people out there in the world and that some of them have medical degrees. Two, it tells us that we in the United States have much more work to do in order to improve and rectify our healthcare system. Even now, 4 years after the passage of the Affordable Care Act, we remain the only country in the developed world which depends on for-profit corporations and individuals to provide health insurance and health care to the population. Even a publicly funded system like Medicare, which provides better coverage at lower cost than the private health insurance system, is subject to this kind of fraud. We have had cases where Mitt Romney's Bain Capital and other investors have invested in physician chains, clinic chains, and pharmacy chains and forced them into such a highly leveraged situation that they're highly pressured to maximize profits in order to meet their expectations. We also have individuals like this doctor who in our for-profit system have a horrific incentive to mistreat human beings in return for profit. While this is an extreme case, studies show that many individual doctors and clinics do in fact overtreat patients because our system gives that incentive. That system needs to change so that more innocent people aren't harmed. I'm Richard RJ Eskow for the Zero Hour.